The broadcast is now starting. All attendees are in listen-only mode.
On, guys, so I'll just try to mute myself, okay?
We can hear you, Rich. Hey, welcome, everyone. This is Dr. Guy Yatros from Dental Sleep Solutions and DS3, and we have a very exciting evening here tonight. Started off with a little audio issues, but I think we got it started right on time as usual. And I'm here. My good friend, Dr. Richard Drake, is with me, and founder of DS3. We won't spend a lot of time introducing ourselves, but I think a lot of you know who we are. We spent the last 20 years doing dental sleep in our practices and trying to help dentists do the same for at least the last dozen years. We'll talk a little bit about how we might be able to help you in a little while in your practices. But I'm real excited, Rich, to have our friend and colleague here, Dr. Jagdeep Bijwadia. It's a subject that I think is coming up a lot. And welcome. Can you hear us all right? We got our audio and everything straightened out?
I can hear you just fine.
Well, welcome.
Thanks for inviting me.
Yeah, I have up here on the screen. I hope you can all see the screen and your bio, and it makes Rich and I look like a couple of peons, I think. As I was reviewing this earlier today, you've had quite an impressive past and present in sleep medicine, and I'm excited to learn a lot from you today.
Too kind. Thank you.
Well,
absolutely. No, I'm super excited to be here. You know, obviously I've known you, Guy, and Rich for some time now, and it's great to finally interact in a way where I think we can collaborate into the future.
Absolutely, and I think this is the future that we're talking about. I know some about this. We've started to utilize your services some in our practice, and I just think this is something that's going to help the dentist as we move forward, getting involved in dental sleep. So, you know, Rich and I are certainly not the experts in this area, so we're going to kind of let you take it, and we a little bit of house cleaning. If you have questions, type them in the question box, please, and we will get to all of them before the night's over. We have several hundred people signed up for this. We'll have, I assume, over 100 on here, almost already have that. So we can't unmute everyone, but we'll get to your questions if you type them in the question box as we go through, and our team will answer some of them, and what we can't answer, we're going to ask Jagdeep to answer for us. So take it away.
All right. Well, hey, Guy and Rich, thank you both so much. This is, you know, what a great opportunity to be able to talk to people that, you know, I've known for so long, respected, and you know, I think that this is something that I'm very passionate about. And, you know, just to frame it up, you know, my background obviously is as a pulmonary and sleep physician. And I was chief medical officer at Somnomed for quite some time. And so I really had a chance to delve pretty deeply into the dental space and sort of understand some of the issues and barriers and challenges that we have working together. You know, what strikes me most is that all of us are trying to do exactly the same thing, which is, how do we get the patients to the best care, right? And but there are barriers and there are challenges, and I think that you know, I hope this is going to be a really honest and introspective dialogue to say, like, hey, what have we done wrong? How can we improve it, and how can we work together? Is sort of my aim, and I think that's why I started SleepNetRx. You know, I really felt that there has to be a way for dentists and physicians to work lockstep together to make the patients in the center, right? And so as we go through this presentation, I just want you to sort of like keep in mind where I'm coming from, because, you know, maybe I haven't got it completely right yet, but I think that, you know, my intent certainly is to decrease the barriers for the patient and get them to the best care. And I think that, you know, one of the things I'll say right off the bat is I don't think as sleep physicians we have been good partners. I really don't. I think that we, and I'll walk through some of the challenges that we all experience, but I don't think dentists in general have had really good experience. I mean, there are many exceptions, so I will say that off the bat, But there are also many dentists who I believe have probably worked with sleep physicians and not had a greatly satisfying experience. So let's talk about why that happens and how we might solve some of these issues. So if you could just shoot to the next slide. Yep. So telemedicine, first of all, is not a new issue, right? So we've thought about, how do we make a diagnosis without actually seeing the patient? Long ago, they thought about, in 1925, believe it or not, they thought about, can we make a diagnosis over the radio, right? And today's technology is so advanced that we don't have to rely on the radio. We can rely on real live technology like we're doing right now, and it's allowed us to take care to a next level. And unlike some specialties, a surgeon, for example, cannot diagnose appendicitis on a video. But sleep disorders are typically fairly straightforward. I need to do an upper airway exam, which is really easy to do on a video consult, and I can ask all the right questions to make sure that we're taking the patient down the right path on video. So I think that this is a really, really good use of technology. And if you move to the next slide. I think, one of the things that I've always felt, and something in the 5 years that I was Chief Medical Officer of SomnoMed, and I've moved away from that position now, I always felt that, hey, are there barriers to patients getting to the right diagnosis? And to give you some background, I suffer from REM-related sleep apnea, right? And I was not a fan of CPAP. I tried it. Could I tolerate it? Yep. If I really, urge myself every night to say, like, hey, this is really important, it's good for your health, do it. Yes, I could keep it on, but it wasn't the most comfortable therapy. And I'll ask you, as an audience, as dentists, I'm sure you've identified patients that have sleep apnea. Perhaps they're mild. They really want a dental device. You take them to your local physician, and they end up on CPAP, right? Almost every patient that gets diagnosed with sleep apnea. And I think the missing ingredient to me is, have we asked the patient what they want? I mean, are we being true partners with the patient where we're saying, like, what would you use for the next 5, 10, 15 years, 20 years? Because you have a disease that needs to be managed chronically. So I think that's one aspect of it. And the other thing I think is true is that the cost of getting diagnosed is really high, right? So we tend to refer patients. They end up sometimes with polysomnography. Sometimes they end up with split night titration studies, and it sort of goes on. And I think that we need to recognize that the cost of care is too high. And can we bring that down? And my job as a physician is to sort of think about, what can I do on my end to make sure that this is a seamless, patient-centered approach where the cost is something that I can manage for the patient.
Right.
So that was sort of the basic idea behind using sleep medicine. So if you move to the next slide. So, as we start thinking about telehealth, I think it's important to sort of figure out, like, what exactly do we mean when we say telehealth? And really, telehealth is a collection. It's a means of methods of enhancing healthcare, public health, health education, and support. So it's a very broad term, right? But what we're talking about in this talk today is really telemedicine. And telemedicine refers specifically to clinical services. So how can I translate sleep medicine into a usable platform for physicians, for patients and dentists? And how can we interact together to get the patient to care? So that's what telemedicine means. So advance the slide.
You know what? Can I interrupt you just a second? This fits perfectly in with what Rich and I started DS3 for. I mean, I don't know about Rich is sitting there thinking the same thing, but when we were frustrated a dozen years or so ago because of what you just said. We would send patients to the physician that have an AHI of 7. We'd never see them again. They'd give them a CPAP. Patient wouldn't wear it. Maybe a year later, we'd have someone come back and say, well, maybe we'll do a dental device now. And that's why we set out on our mission. And it was back when PSGs were the only show in town. And really what we've tried to do is to break down these barriers. I think this really fits in perfectly with our belief at Dental Sleep Solutions and DS3, and we're trying to make it better access to care for the patients and helping the dentists provide these services. So this is fantastic. We're out on the same line of thinking right now.
Love it. Yeah. Well, again, I think the alignment of our values is sort of why we're together here today. If you think about the benefits of why telemedicine, right? Number one is it creates value. Not only for the providers and dentists and physicians, but also for payers and consumers. And we'll go through sort of how our platform works in just a second. But I think we're trying to aim at reducing barriers and reducing cost, and that benefits just everyone. It improves consumer access. It enhances the reach of healthcare services to everyone, and there's just a higher customer satisfaction. We've talked to patients that have used our services, and they can't believe, like, my God, I can do this in the comfort of my own home, really, for this cost? So I think that it's something that I feel has a lot of benefits for all the players in this space. Next slide. So, I think it's important for us all to recognize that when we think about telemedicine, there's sort of like a few different definitions that we have to be familiar with. So one is called asynchronous telemedicine. What does that mean? If you think about a radiologist, right? A CT scan is done a week ago. Now the radiologist is reading it, writing a report, and sending it off. So this is not the patient and the physician interacting in real time. It's a store forward. It's an asynchronous telemedicine. And that's been, it's useful in, for example, I'll say radiology, pathology. Those are good examples of how asynchronous telemedicine works.
Okay.
But there's real-time telemedicine, which is where we are interacting with the patient in real time. The patient's actually talking to us at the same time platform. And that is what we do, which is called synchronous telemedicine. And lastly, nowadays, there's this new concept called remote patient telemonitoring, which means I've diagnosed a patient, they're moving on with their congestive heart failure or whatever treatment they have, and we're interacting over time, over months and weeks to take care of them. And that's called remote patient monitoring. So those are three definitions that we need to sort of understand. So we're really playing in that middle space, which is the synchronous telemedicine.
Weird,
Move to the next slide.
Could not lock the dentist. Like, how could you not lock it? I mean, I wonder if all the trash is piled on.
Someone needs to mute themselves. There we go. Okay.
So when we think about synchronous telemedicine, especially in the dental sleep space, there's a few, I'll say, must-haves, right? Any telemedicine platform that you work with. And today there's SleepMedRx, which I think is the first national sleep telemedicine platform in the US, which I'm super proud to be part of. But for any telemedicine platform, think about these things. Do we have patient consent to do a telemedicine, right? Because if you haven't explained to the patient what the real deal is, that's not appropriate. Are you ensuring the patient's privacy? Do you have cybersecurity in place? Are you HIPAA compliant? Do you follow the same standards of care as in person? That is absolutely key. I think a patient coming to our platform will receive exactly the same care as if they went to their own sleep physician down the road. Very important. Do you follow all the state regulations for sleep telemedicine and national regulations and the guidelines? Do you have an electronic medical record that keeps the records for 7 years, which is legally required? Do you have clinical protocols and contingency instructions for the patients? So all of these things are very important infrastructure to be able to create this platform. And if you ever work with any telemedicine platform, ask these important questions before you sign up, because I think they're really important in terms of security.
Next
slide.
Is there any trash?
Oh, hold on one sec. We're trying to figure out who that is. Can you?
I just muted Rich by accident there, but okay. Go ahead, Jagdeep. I think I muted Rich by accident. I was trying to find out where that static was coming from.
We'll move to the next slide.
Okay. Oh, hold on. Sorry.
I think we're okay. So one of the things to recognize is that the American Telemedicine Association showed even in 2017, 3 years ago, that 40 states and the District of DC had adopted substantive policies and received awards that actually improved the coverage of telemedicine. So this is something that I think all of us should recognize is really supported by government, by regulatory agencies. And so even though this seems cutting edge today, it's already everywhere. There's telepsychiatry, there's tele-ICU, there's teleradiology. So what we're doing today is just following the path of what's already in place. And I think that it's something that's going to be supported long term. I think most of you have, or maybe some of you have looked at the articles that have talked about coronavirus today. And Medicare just relaxed its rules, right? And they said, hey, please use telemedicine so that we don't have to have the patients come in. So this is something that I think is something that all of us will see much more of as time goes on. Moving to the next slide. You know, as we start thinking about deploying telemedicine into the dental space, I think one of the things that we should ask ourselves is, are we really moving the needle to where we shouldn't be, where we're really trying to, you know, carve out new paradigms? And really, no. I mean, even the American Academy of Telemedicine, of Sleep Medicine, is very supportive of the whole telemedicine concept. They have a whole position paper on how to practice telemedicine. And when we started SleepMedRx, which I'll talk about in more detail later, we've looked at that position paper in great detail and said, how can we make sure that all of the parameters that are standard of care today are being followed by our platform? And so again, you know, I think it should be reassuring to everyone that if you try telemedicine, you're not moving out into the unknown. You're really doing something that is very mainstream and very supported by the payers, by the government, and by the American Academy of Sleep Medicine.
Oh, it's the sleep medicine.
Yep.
Okay.
Next slide.
I don't know what that sounds. Can you talk now, Rich, or did I unmute you?
Test. Can you hear me?
I got you unmuted. I don't know where that extraneous voice from the heavens is coming.
Yeah, it's coming in from a phone call somewhere. I'm trying to catch it when it does it. So sorry for that, Jagdeep. Go ahead.
Oh, no worries. Just, you know, remind everybody to mute themselves as they listen in.
All right.
So, you know, as a chief medical officer at SomnoMed again for many years, you know, one of the things I realized is that if there's a new dentist that's trying to enter the sleep space, they have some real challenges, right? You know, one of the biggest challenges is trying to learn the skill. But that somehow is made easy by, you know, the AADSM, by the DS3 courses, you know, all around the country. There's a lot of experts that are willing and able to train us in the skills that are needed to practice dental sleep medicine. We then have to figure out, like, okay, once I learn the skill, how do I go back and put it into my practice so that all the patients are screened, my whole practice acts as a team? Again, challenging, but doable, right? But then how do we get patients tested? Once we identify somebody at risk for sleep apnea, how do we get them tested? How do we do the sleep studies? How do we get them interpreted by a diplomate of the American Board of Sleep Medicine, which is required? How do you actually get the prescription for the sleep test back? How do you build new referral sources? And lastly, how do you get paid? So if you think about it, there's just a lot of challenges for a new dentist. And I know that, you know, certainly Guy, you and Rich are addressing many of these challenges in your courses and in these sort of platforms. And I'm so happy that people are giving patients more choices than CPAP. Again, I will emphasize that I was a CPAP failure. As a sleep physician, I'm very empathetic to people that cannot tolerate CPAP. We must give them choices. But how do we get them past these challenges? Next slide.
Yeah, I was laughing, Jagdeep, because that looks like a list Guy and I made quite some time ago. And you're right, we have been working on it for years. So we're on the same page.
Yeah, and so as I was thinking about all of these challenges, I'm thinking like, look, everybody's trying to do the right thing, right? We're trying to follow all the guidelines, we're trying to follow all the regulations, but for God's sake, we got to get the patients on treatment. So what happens is ultimately workarounds happen, right? How do I get past these regulations and just get my patient on therapy? And so ultimately what happens is we have sleep dentists. They see their patients, they know they need care. With the best of intentions, they try to figure out like, okay, how am I going to get this patient tested? Do I actually need a sleep physician in to interact with the patient? And so ultimately we try to do all of these workarounds. And to me, it's like, are we actually following standard of care? Who can blame us for not, right? There's so many barriers to doing the right thing. And my whole premise is, let's make it easy to do the right thing, right? And that's where SleepMedRx comes in. So moving on to the next slide. So because of all of these workarounds, one of the things that's happening, which I think is really unfortunate, is that payers are taking sort of the role of being the police, right? And they're saying like, hey, wait a minute, if you don't have sleep doctors involved in your sort of paradigm, we're going to put the brakes on it, right? And if you look at the policies by United Healthcare, for example, they say that medical notes have to document all of the following. And one of them, if you look at the second bullet down the line, is clinical evaluation by a qualified sleep physician, MD or DO trained in sleep medicine, right? So here's an example of a payer putting the brakes on and saying like, hey, wait a minute. If you are not involving sleep physicians in your collaborative care, we're not going to pay you. I think that's really unfortunate because I think that what they're trying to say is like, hey, do the right thing. Even recognizing it's not easy to do the right thing. So how do we as a team, right? Rich, you, me, Guy, how do we make this happen for the nation so that we don't have to worry? How do we make it easy to deploy this? And I think the answer really is what we're trying to do with telemedicine. So move on to the next slide.
Yeah, so we're going to take a slight pause there for a second. There's a question that comes up, how do we specifically do this? And we're going to get into that in just a moment. I want to mention that there's two reasons why this is important. We have a slide up here on the screen about payers. I think we concentrate on getting paid a lot as dental sleep dentists, and sure, that's important. But there's sometimes other workarounds people use that maybe get them paid, but I think liability reasons and doing the right, I like what you said, doing the right thing. I don't think we should be trying to go out and do this without involving the medical doctors in the community. And I think this is a way to do the right thing, help ourselves medically, legally, and get paid. So I think sometimes we concentrate too much on the getting paid part of it. That's what I'm hearing from you, and I agree. Take a quick little break here because we're in the middle of the webinar. Just a little housekeeping. If you want CE for this, you will get it within 48 hours of this webinar. You'll get it into your inbox. If you don't find it in the inbox, please look in your spam folder and you'll find that. And we will be doing a few more webinars coming up. So here's the dates of those, April 14th and May 12th. So just write those dates down. We'll be talking about so you're saving teeth and saving, are you saving lives? Basically, for those of you somewhat new to dental sleep, we're going to be talking about why you should be involved and a lot of things that have changed since we've started doing this that make one of my sayings, Rich, I say when we do courses now, is you don't know how good you've got it. Like I'm preaching to my 13-year-old, but there are a lot of barriers that are lowered, things like telemedicine, home sleep tests, payers are paying more. So we'll talk about what's changed. And we'll also talk about the dental devices, which ones we use coming up in a few weeks. And for those of you who don't know what we do, we'll talk a little bit more at the end, but we preach about the 4 pillars: screening, testing, treating, and billing. And what we do there is if you can find a way to have these systems in your practice to screen, test, treat, and bill, you will be successful. And that's what we do at DS3. I think a lot of people, we were having a conversation about what we do with some colleagues a few weeks ago, and they're like, well, you're software. Yeah, we do a lot more than that. We help you all along the way. And we do courses all over the country. I'll put this up at the end too, but just you might take a screenshot of that or take a glance at it. If you see one of these courses coming up that are in your neck of the woods, or even not, come see us. You will learn how to, when you leave there, how to really get started doing this. And if you type course in, it secures you $200 off. So I think that's it. That's how you get a hold of us, and we'll put that up at the end as well. So back to your company, and I think the question that popped up here, and I even got a text about it saying, you know, how do we actually do this? And I think you're going to get into a little bit of that in the next half hour here, I suppose, correct?
Yes, absolutely. Yeah. So let's talk a lot about the background and why we do what we do.
Right.
And I want to just make a quick comment here. Just because you have the ability to work with telemedicine doesn't mean that we don't encourage you to work with your local sleep physicians, right? And your local physicians. Absolutely. You know, the bedrock of your practice is going to be local sleep physicians referring patients to your practice. Okay, so use us when you need us, right? If you're in a rural area where you need help, if you have physicians that aren't collaborative, we want to be your friend, but we don't want to take over a practice that's actually working great. If you have collaborative, practices within your local communities, please do that. And so I just want to emphasize that as as a good ethical physician. But I think the idea that we have with virtuously is to eliminate barriers for dentists that treat sleep apnea and collaborate and meet all the published guidelines, right? I think one of the things to recognize is that when you do not involve a sleep physician, recognize that you are liable, right? Because you are actually responsible for the care of the patient yourself at that point. And to me, why would you want to do that? Why would you not want to share the liability with a physician that is, I have a relationship with all of my patients, let me take on that liability. Don't do it yourself. Let me be your partner, is the point. I think we want to focus on patient choice. If patients want dental devices, well, heck, let's get them to that, and I'll talk a little bit about that later. We want to keep the costs down. We want to keep the office flow easy so that we've tried to make it really seamless. And most importantly, track every patient's progress. From the time you refer to us to the time the patient gets a dental device, you should have visibility. So let's talk about how we do that. So Sleep is really a multi-partnership. It's a partnership between DocBioWeb, which is a telemedicine software or a platform that's an IT-based platform, SleepMedRx, which is a experienced sleep telemedicine practitioner practice. So I have 8 physicians and 5 nurse practitioners that cover the United States. We'll talk about that in a minute. And then Virtuously, which is a home sleep testing company, which we happen to have partnered with. And that does all of the testing within the United States. And one of the big reasons we partnered with them is they're in network with all of the payers. So we feel that that's an important aspect of what we can bring to the table. But most importantly, it's a seamless pathway for your sleep apnea patients to go from screening to being treated with oral appliance therapy following all the guidelines. Moving forward. So the benefits really are the fact that you get a secure platform. You never have to worry about cybersecurity, HIPAA compliance, things like that. You're going to get very experienced sleep physicians that are, often directors of various sleep centers, many years of experience in the field. And I think I should emphasize this. We only choose sleep physicians that believe in oral appliances, right? So if I'm interviewing somebody that wants to be part of my practice, and they say, well, I'm not sure sleep oral appliances work. We just don't want them on our platform because I want somebody that believes in patient choice, right? For mild to moderate sleep apnea, we know dental devices work. We know that for severe sleep apnea, if they've tried CPAP, for God's sake, treat them with something that's going to, help them improve their lives, right? So unless I see that passion for an oral appliance, they're really not part of our platform. And that's, I think, an important point. So when you refer to us, there's going to be a very oral appliance friendly audience. Certainly, we want to have telemedicine done in the comfort of the patient's home. We've done consults with truck drivers that are parked on the side of the road because they don't have the time to do it. We want to eliminate multiple visits to the specialist. We'll talk about how we do that. We want real-time updates for you so you can follow these patients. And then we also offer chain of custody testing for DOT drivers, for example, and fast and efficient turnaround time. So moving on. So how do we do it? Step by step. So first of all, you're going to identify a patient who's at risk for sleep apnea. You can do that through Epworth. I mean, I'm sure you all have really well embedded, you've trained with DS3, you've trained with other practices, you know how to identify a patient with sleep apnea. So once you know that a patient is at risk, we actually have the patient move to the front desk and go to the next step. So we basically ask the patient, and I'm sorry, we moved too fast. But once you've identified the patient for at risk for sleep apnea, we ask you to have your front desk staff schedule the appointment before they leave. I think this is absolutely critical, and we make it so easy on our platform. So once the patient's name and email is in, you automatically get a list of the physicians that are licensed in your state. You click a schedule time, and before the patient leaves the office, they already know when they're going to see the physician, which is usually within, I'll say, a day or two of them leaving. And I think that quick turnaround time and ease of scheduling is actually very critical to the whole process. So then the patient prepares for the consultation. So they log into the portal, they complete their medical history, and on the day of the consult, they'll get an email or text saying, "Hey, remember you got an appointment coming up." And so they'll go into the portal, log in with their name and password, and all of a sudden you go to step 3. So with the step 3, which is the actual telemedicine consult, the patient and provider both log on to the same time, very much like you would a FaceTime or a Skype, right? The only difference that it is completely cyber secure and HIPAA compliant. So nobody can sort of, I'll say, eavesdrop onto your consultations, which is one of the requirements. So the patients, the providers actually record the clinical notes as they're talking to the patient, and it is stored and available for review later. And right after I finish talking to the patient, immediately there's a button that I click, and the patient has a home sleep test automatically referred to. Right now our partner is virtuously. So right away we'll refer the patient on for a home sleep test. Moving on.
Sorry, there you go.
No problem. So after the home sleep testing is done, the patient will get a call from the Virtuox team, verifying their insurance. Hey, give us your address and everything like that. A home sleep test is mailed to the patient's home. There's 24/7 support. There's instructions that are written within the home sleep test. The patient completes 2 nights of study and sends the device back. Even though we do 2 nights of study, that's really so that we make sure that we have adequate amount of data. But the patient is billed only for 1 night. So we always bill the insurance for 1 night of testing because we choose the best night of data. And then we move forward. So step 5. So then what happens in step 5 is that the study results are reviewed by a sleep physician. Typically, it's the same sleep physician that's actually talked to the patient. And this is very different from many other practices where, maybe the patient has been seen or not. But we have a group of nurse practitioners that has physician supervision. So if a nurse practitioner sees your patients, it's always going to be the sleep physician that supervises that provider. So there's that continuity of care. And the results, once we're done, are immediately available for you to review on your platform. And once we are able to see that the patient has obstructive sleep apnea, we write the test result and we order the dental device right on that same platform. So moving forward. So you as a practitioner, as a dentist, can see all of the steps that are happening in real time. So here's a for example, a dashboard. These are the number of patients you might have referred. How many of these patients have actually gone through their consult? How many went on and had a home sleep test? Are the results back? Can I actually see how many dental device prescriptions were ordered for my patients? So on a month-to-month, on a year-to-year basis, you can actually track your progress as your practice grows in a very easy and seamless way. And as soon as we do a consult, you can see it. As soon as we do a home sleep test, you can see it. As soon as I write the dental device prescription, you can print it out. So it's a real-time, very easy platform. Moving forward. So these are the the various sleep practitioners and nurse practitioners we have in our practice. Some of you may recognize Chris Leteri up here. He was the head of the VA sleep in Washington D.C. and an advisor to the Joint Chiefs of Staff. Right? And it's sort of like, how can I brag more about people that are in my practice than somebody that advises our very army or very military? Ed Saul is the Chief Medical Officer of Ventus. Lee Serkin, Chief Medical Officer, and also works with Virtuously right now. He's a cardiologist. We have Kunal. We have, a whole bunch of people that are super, I'll say, qualified to work with your patients. And then at the lower end here, we have nurse practitioners. All of our nurse practitioners actually go to the University of Pennsylvania online training program, so they have certification from an Ivy League school. We work very closely with them. Every single sleep nurse practitioner has a sleep physician that is directly working with them. On the left-hand side, you see Kyle Michael here. He's the owner and the founder of Virtuously, who works with us in terms of our home sleep testing. And of course, our network covers all 50 states. So we're able to see patients anywhere in the US for you in a seamless fashion. Next slide.
You want this one or the next?
Next slide, please. Just go on to the next one. Okay, great. Now here's something that's super exciting, right?
Yes.
And I think Guy and Rich, both of you have seen this.
Yes.
And I asked them, and actually I was waiting for this evening because neither Guy, you or Rich know this, but I'm going to tell you in just a minute. So keep so both of you. Yes. So stay tuned.
All right.
What you see here is a new home sleep test, which is really the size of less than a finger length, right? It is able to measure your AHI, oxygen saturation, and sleep time in a super seamless way, just like the WatchPad does, right? At a fraction of the cost. But here's what it also does. You can do multiple tests with this little device. And so as you titrate your patient, you can actually see the AHI coming down over time. This was something that has been developed in Belgium. I know the CEO and the founders really well. And here's what I wanted to tell you both. 2 days ago, maybe 3 days ago, this was approved by the FDA as a Type 4 home sleep testing device. It is reimbursable. We can read the studies for you, and within a few weeks, this can be deployed around the country, right? Wow. So as a sleep dentist, you can use this device, you can help your patients titrate the device, and maybe the first test and the last test you get read by a board-certified sleep physician so that you have everything covered, right? This is, it's going to retail, I know you're going to ask me this, right? I can see it on your faces right now. It's going to retail for about $1,500. And you can do 5 tests on this device at $5 a piece. So for $25, you can do 5 tests, correct? And I have permission from Kyle, who's my partner.
Yeah, he's on.
I think the desktop.
Yep, it's excuse me, yeah. So I have permission from Kyle to actually give this webinar a preview of this device, and instead of $1,500, it's going to be $1,199 just for the group, just for this webinar. And I'm super excited about this because you know what? I think that this is an objective way a simple, objective way for you to follow the patient's treatment course as it progresses in your dental practices really easily. So look for this in the American Academy of Sleep Medicine and American Academy of Dental Sleep Medicine conferences to come up. And again, you know, out of respect for the both of you, I have this permission from Kyle to introduce this.
Wow.
Tell you about the FDA, and yeah, it's a really exciting time.
So I've had an opportunity, I think Rich has too, to kind of pre-test this out before it was approved as part of the trials. And I'll have to say, it is absolutely one of the most exciting things I've seen. You know, you put this little thing on your finger about the size of a chiclet. Those of you remember what chiclets are, I don't know if they still make those, but and you don't even know it's there. It's the first test I've ever taken that, you know, you literally, I think, sleep pretty much the same as if you didn't have. It's like having a Band-Aid on. And I think that's one of the things that we always talk about with sleep tests, that, you know, we can't test people without affecting their sleep. And, you know, unless a Band-Aid's going to affect your sleep, this thing really is amazing. That's exciting. It's exciting news. Yeah. Thanks for sharing it with us. Kyle, I did unmute you too if you had anything to say.
Hey, Guy. Hey, Jagdeep. Hey, yeah, this is. Can you hear me, Guy? Can you hear me, Jagdeep?
Yep.
Great. Thanks to the audience, and thank you for DS3 for hosting us. And yeah, we're excited. On Friday, we were all doing. We call it the MC Hammer dance, if you remember the dance move he had. But you know, we're all doing the dance move on Friday night because after a year and a lot of back and forth over the last 30 days, we have a summary letter. We have a 510K. We have a predicate device that is listing the WatchPat as the predicate device right in the 510K letter. So essentially, it's PPG or PAT, and it's essentially the same thing as a WatchPat, but miniaturized. And you know, a lot more cost effective when it comes to care. Yeah, so the first generation that we have devices for sale right this second is the reusable model. We are in the process of getting the disposable models in-house, but we have them for sale right this second. We have an introductory price for you guys if you want to place an order before Friday. I think Jagdeep said $11.99, and they go up to $1,500. They go up to $1,500 after next week, but nonetheless, these are for sale. They're ready to go. They're in stock, and we're taking orders. If anybody wants to, you know, write down my email address and email us, we're happy to, you know, get your bad boys, these things right into your areas. A lot of people have tested them. We handed out a lot of them at the different shows, and they definitely have worked really well. But my email address is Kyle, K-Y-L-E, period, Miko, M-I-K-O, at virtuox.net, virtuox.net. And, you know, like I said, those devices are ready and available. The disposable, we're looking about maybe 30 to 60 days out, but we're excited about the opportunity to, you know, continue to innovate and come up with solutions that help people sleep and breathe better with our baby Doc via Web, which is our telemedicine application, and then Virtuox, which we're the largest IDTF in the world at this point, for those who don't really know us. But I'll send it back to Jagdeep. Thanks, guys.
Thanks, Kyle.
Thank you.
Yeah, I think we just posted your email on, and if someone didn't get it, please, someone at the DS3 team there posted on the answers over there, or you can certainly contact us and we'll forward that. And again, I know Rich and I have used it. It's very exciting that those are now going to be available. Congratulations, y'all. That's a big high five on that one. Yes, exciting for all of us.
I was trying to keep it under wraps for this webinar. So wow. I didn't call you guys to tell you, but yeah, it's a fun time. It's a fun time.
You're the first to know about it, guys.
Well, that's
really.
Thank you.
We haven't let anybody know about it in the public. We're itching. We're ready to tell people, but you're the first.
This may sound cheesy, but literally the hair on my arms is standing up. I'm so excited about this. It is such a thing that makes our lives easier, especially when we look how we teach our members. When you come to our courses, we talk about doing a 3 to 5 day titration with the dental devices. So for I'm hearing $25. Is that what it's going to cost me to let them wear this 5 nights in a row?
Yeah, we're going to have a couple different models where you know, they're going to be called credits.
Right.
So like for one, it can be as little as $5 a night, as little as $4 a night, and as little as $3 a night, depending on how many credits you pre-purchase. So like a package of 10 credits for 10 patients is $250. That's $25 per patient, or $5 per night. That $5 patient or 5 test kit for that patient is good up to 60 days. So you can do your diagnostic or your patient up front, and then of course you can do your titrations later on in the pathway. And then after 60 days, that 5 credit disappears, and you got to purchase another one. But if you purchase in increments of 10, it's $25 for the patient. If you purchase in increments of 50, it goes down to $22.50 for the 5-night. And if you purchase in a credit of 100 patients, then it's $20 for that 5-night. So it goes down from 4 to the 5, 4.5, and then down to 4. So
that's fantastic.
Very economical and easy to use.
Yeah, just a little bit. We'll talk about our courses again. We teach how this used to take us a long time to get to the right position, but now with something like this, we can get them comfortable wearing it, and then we can have them move it to multiple positions over 3-4 nights. And, you can take this process that used to take months down to a week or 2 to titrate these devices. So this is fantastic. Congratulations again. So,
I think, from my perspective, the combination of something like a sleep telemedicine platform and virtuously, I mean, we are really looking at the future of dental sleep medicine, right? We're going to make it so easy to do the right thing. I'll say it should be a no-brainer for us to just move forward and make patients sort of at the center and give them the therapy they want.
Right.
So moving on to the next slide. So here's another little piece of technology that I think is sort of interesting and cool, which is better. It's a little device that you place on your forehead. It's a consumer device. So the patient would just buy it for $150. And the nice thing about it is that it does overnight pulse oximetry on the forehead that is medical grade. So this is, again, FDA approved for pulse oximetry, and it's interactive. So it gives the patient what's called the stop breathing index. So it'll tell the patient, hey, you had, 15 events that might indicate that you have sleep apnea, right? So now all of a sudden the patient's going to be engaged and think like, hey, perhaps I should do something about this, especially if they see night after night after night that they're getting the same message. So this is a company out of Silicon Valley called Better Sleep. I happen to be the chief medical officer of it. And again, to me, it's about how do I engage that patient in the fact that they have a disease that we can actually intervene with and improve the rest of their lives. And then how do we take them down a seamless pathway to get to care? It's all part of the same sort of pathway, I'll say. Next slide. So again, the Better app it gives them a little very user-friendly way of saying like, hey, you had a good night's sleep or you're poor and you have the potential for something that you need to do something about with sleep disordered breathing. Next slide.
Yes.
So I think I want to maybe end by just talking a little bit about where my vision is, right, for Virtuous Sleep. And right now we're talking about you referring patients to us, right? So when you identify a patient in the office, make it easy for them to talk to a sleep physician, make it easy for you to get the prescription back, and that's all great, right? But Virtuous Sleep is not something that's limited to the dental space. So in the last 3 months, we've had a contract signed with a company called Amerigas, which carries propane around the country. They have 6,000 drivers across the US. They look to us to guide their care. Now, what about patients that are not able to tolerate their CPAP and they are going to lose their livelihood? Guess what? I'm going to need a dentist that I can work with, right? And this is just the first example of a company that has said like, hey, we want to work with a telemedicine company. We have constant inquiries. We've had inquiries from Inspire. We have inquiries from Intel. We've had inquiries from a lot of companies that are thinking about, can we go direct to consumer and work with sleep medicine physicians that are available virtually? Well, guess what? Not everybody is going to need CPAP, and we're going to need a dental network. So as we start working together, my vision is that we're just a conduit both ways. We're going to take consults from you back the same. And so being part of our network is really a part of being a practice of the future. And I sort of want to leave you with that thought.
Right.
It won't happen tomorrow, right? But it's where we want to be. And so I'll just leave it at that.
Well, I think that's all exciting news. We've got quite a few questions here. I'm going to do, I think we got a lot of them, but I think this is another piece of the puzzle that's going to, it's a big piece between the telemedicine piece, keeping us in liability at bay, or, sharing that liability, getting our patients coverage from their medical insurance, and then streamlining the process. I think it's a fantastic situation. I think we have some questions. I'm going to put up a couple of slides here again. I'm just going to go through those. Someone requested the courses. I think I'll put that back up here while we answer the questions. We'll leave that on there for a second. If you want to know more about what we do, again, we teach. There's the courses that I was looking for. We teach courses all over the country, 2 days, hands-on. We do sleep tests. We do make devices. We do the bite registrations. All the things that dentists kind of feel uncomfortable. We talk about how we titrate the devices, all the steps from screening, testing, treating, and billing. The courses are $12.95. If you put in course, you'll get $200 off. You can see the upcoming ones, and if you can see the fine print to the left, here's the ones throughout the year. Or if you just want some help, just type in course consult, and we can help you and tell you what we do here. So a couple questions that came up, and Rich, did you have any on there?
Jagdeep. I said, well, finally see his video
There
came
you
up.
go. There, your pretty face.
I love to say his name. That's such a cool name, Jagdeep. I was named Richard. That's just not as cool as Jagdeep. But
yeah, except I always have to pronounce it 10 times before somebody, my patient, get it. But that's okay.
Yeah, it's just like it's spelled. Hey, tell us about. Guy, I've been reading through some of these questions. Are there any, difficulties with any of the states out there in particular, or is this pretty much all across the U.S.?
Yeah, so telemedicine is accepted in all 50 states, right? So our practitioners are always licensed in the state they're in, as well as the state they're consulting. So for example, if I was doing a Virginia teleconsult, I would be licensed in Minnesota as well as Virginia. And that is true for all of our providers. So we take care of that. You never have to worry. A patient would never be able to connect with a physician that is not licensed in both of those states. So that's something to remember. But a very important, it's a great point, because I should have made this while I was giving the presentation, is that Medicare for now requires an in-person face-to-face. So if you have a Medicare patient in your dental practice, the telemedicine practice that we have would not be a solution today. Now, hopefully with time that will change, but that's an important distinction that we need to make.
How about commercial insurances? Do most of them cover it? Some of them? How do we know if they cover it?
Right. So Guy, the way we've designed the program is, it was not practical for us as a group practice to get licensed, to get credentialed with every single payer in the U.S.
Right.
So what we've done is we have kept our cash pay price at $95, which is right where I'll say a specialty copay is for most insurers. So we really charge what a patient would be paying to go in person if they had in-network coverage.
Okay.
So again, it's an attempt to try and decrease those barriers. So yes, it's a $95 cash pay, but then the home sleep test, because it's done through virtuously, is always in network. So we really have this great program where you do a very low cost consult that's equivalent to a copay, right, but then you get to do a home test in network.
Now, if they pay cash, is that ever a situation where commercial insurances will say that some of them require face-to-face, they go by Medicare guidelines? Do they still cover that even though they paid cash, or do you run into that much?
So the patient, we can give the patient a receipt, right, for that $95, and they can submit it to their insurance.
Okay.
So, certainly that's possible.
Right.
We have seen very, very few patients really want to do that because it's just such a hassle to take, less than $100 and go through the whole insurance issue. But I think that it's certainly something that would be covered by most insurers as out-of-network benefit.
Right. So let me reiterate what I'm hearing from this, because I know this is a confusing subject. Is the patients for commercial insurance, it's the most it's going to be is $99 and that's probably what you can just tell the patients it's going to be. And I'm sure there's always exceptions, but for the most part, if they have commercial insurance, we can set up the telemedicine consult. You have the consult, that you order the test, they get the test. There's an additional fee for the home sleep test, but they're in network, so depending on their deductibles. Do you know what the maximum out of pocket for that would be? I'm sure someone's going to ask it.
Yeah, this is Kyle. Am I still on off mute?
You're on.
Okay, hi. So Virtuox is unique. We've been doing Virtuox business for 15 years. We've tested 6 million people. We test 40,000 new patients a month. So it's a big number. It's just a testament to our medical background. Now, a lot of the companies you guys have used in the past are out-of-network cash pay only customers, companies, and they're not really credentialed IDTFs with Medicare and Medicaid and every contract under the sun. We are. So with Aetna, they have certain allowables. Cigna, United, everyone has different allowables, but the most somebody would ever have to pay for a sleep test, I'll call it $280. The highest allowable Virtuox received from any payer in the country is only $280. The lowest reimbursement we accept is $181 from Aetna. So no matter, it could be as low as $181, which is the Aetna, that's the Aetna allowable for an HST member. We're billing one night of test, and we're acquiring 2 nights. We're not trying to double bill and hurt the payer or the patient with extra payments that some of the providers out there do. Nonetheless, we still like to do night-to-night variability testing, but we bill one line of service, so it's very ethical. Number 2, the lowest allowable, $181 from Aetna. The highest allowable, which is Medicare, is about $280. And you have different health plans all the way down, like United Healthcare is $225. So I guess it's an easy way to say the max out of pocket ever would be about $280.
Yeah, I think what you're emphasizing, which I know to be true, is that many people will pay less than that depending on what insurance they have and their deductibles and so forth. So I think that's the take home. So that's, worst case scenario, you're still $380, $79 on the highest end for both the consult and when we train dentists across the country about this, and they get some resistance from their patients, I have to ask them, is it worth $300 to breathe? I mean, I think learning, or even just discovering if you are breathing correctly. I think we overthink this an awful lot. We had a consultation with one of our members' offices we do some training with, and I think just think of where it's come. I think Rich and I have got a little bit of a chip on our shoulder because 15 years ago, it was everyone go to the sleep lab and give them $3,000 for this, or $2,000, or it was a lot more than $300 and change here for this. So you don't know how good you've got it, people out there. If you're just getting new to this, you can put a chiclet on your finger and find out if you have sleep apnea now. I mean, give me a break. What's next?
Yeah. And the whole consultation sleep test thing, you're looking at, less than $400 or $500. I know, guy, I jump across the consult room and I start choking them and I say, is it worth $300 now? No, I'm kidding. I don't really do that. Jagdeep and Mike as well. Back me up a little bit too. I'm a dentist. I'm screening a patient in my office, which we're teaching them how to do. I love what you said earlier about, set them down and make an appointment right now. That would be like, if you go to buy a big screen TV, The salesman doesn't go, hey, why don't you go home and talk to your wife about it? You know, come back next week and we'll do this. So I love that, creating some sense of urgency. Now, the portal that you showed that as a dentist we have, that software, does that software cost me anything as a dentist?
Yes. So typically what happens is that you pay an initial fee of $350 and then it's $99 a month. But again, because we have this relationship with DS3, it's a 50% discount across the board. So just half that. And so for basically like $50 a month, you have access to a nationwide network of sleep physicians, which I think again, our whole aim is to lower the barriers, right? So we don't want it to be a burden for the dentist or the patient. So we want to be able to be available for you guys, and try to make it work for everyone.
Yeah, just to be clear on that, that's the discount for our DS3 members. This webinar is for the public, so I see a lot of our members on here, and so for you guys, you get that discount. If you join DS3, then you get that discount on your services, which is very much appreciated. It's worth the
Thank you.
The full price anyway.
I love the fact too, Jagdeep, that you talked about this going both ways. Right. Because we dentists, a lot of us do have a chip on our shoulder for the reasons that you said. I mean, you pointed out a lot of that stuff very well. Thank you for that. But and I certainly had no idea that Virtuox was doing 40,000 sleep tests a month. That's an unbelievable number that they've done 6 million. So, it's just good to think about that. If we lower the barrier to getting people tested and treated, we're gonna treat more of these people in a way. What is your take on, because Guy and I preach this all the time to dentists, and you're a sleep doc, what is your take on, as a dentist, whether or not I'm in network? How do you think most sleep docs around the country see me as, let's say I'm not in network? How does that affect what you do or who you refer to or whatever?
I think it's incredibly important. I mean, if I think about the patients that come into my office, and I want to refer them to a dentist, one of the first questions they'll ask is, who's in network? And it's not only dentists. If a primary care physician wants to refer the patient to a sleep doc, they'll ask, hey, right, is the doc in my network? I mean, that is people have, they feel like they pay their premiums and they want to go with the network, right? So I think it adds a whole lot of credibility, and you're going to get a lot more referrals if you can get in network. Now, if you're nationally renowned and you're out of network for one, insurer, maybe you'll still, get people to come to you. But I think more and more, and especially if you're in network with Medicare, that's huge. Because a sleep physician doesn't want a patient to come back to you and say, like, my God, you sent me to this dentist and he wasn't in network and I had to pay all of this money out of my pocket. That's not a conversation that most sleep physicians want to have. So yeah, I think, as much as you can, and I recognize it's not easy to get in network, right?
And sometimes you can't. Sometimes they won't let general dentists in network. I think your all's technology, though, there's two ways of looking at this. So Rich and I have had these discussions, and we could probably talk about this till 2 a.m, and we won't, by the way, but is that if we can reduce the cost by having a $25 sleep test, and I can do this a lot more efficiently. We've been tracking deductibles just on our people we do billing, and they're going up and up and up and up. And when the deductible becomes $3,000-$4,000 in network, and if we could somehow provide this service for way less than their deductible, I think there may be a place where that crosses, and it's more feasible. Hey, you can just do the dental device, and I think there's a place where that can change. So there's one other question on here I want to get to, because I think the person's still on. What about a follow-up exam here? Is that available? Can we do that?
Yes. So typically what happens is that when we do a consult and a home sleep test, we send all of the results to the dentist, and most dentists are pretty comfortable reviewing the results with the patient and moving forward. But we always inform the patient, hey, if you want a more in-depth discussion, if you're looking for other options, if you want to talk about other things, always feel free to call us. It's $95, right? You swipe your card, you can see us anytime you want. So I think that again, I am not about mandating follow-ups, right? I'm about what can I do where I give the patient the control. And that's the whole philosophy of SleepMindRx. And again, do the right thing, follow every guideline. And I think we've been able to do that.
This is awesome. Well, to reiterate, on our behalf, anybody who's interested in these courses, I'm going to change a slide. We might be doing one in your area. Type in course. You're not obligated. It'll give you that discount. If you want a consult, type that in. You were just at the symposium last month. It was a really good meeting, wouldn't you say?
Absolutely. Yeah, and I'm looking forward to next year.
Yeah, next year we'll have you there. We're moving it in a couple of weeks because Super Bowl's in Tampa around Valentine's Day, so we're moving it to March next year. So just public service announcement. We don't really even have to push this course much anymore because we sell out every year. The rooms will sell out at the discounted price of under $300. So this is being recorded here in March. Don't call us in January and complain the rooms are $500. Sign up now if you want the discount on the rooms, because every year we get a slew of people complaining about that. I'll briefly mention that for those of you who really want to know more about this, we've last couple of years been doing our DS360 Premier Tier program. We have a very limited number. We do hands-on consulting with a 2-year program. If that's something that interests you, certainly reach out to us. But I wanted to get to this slide. Right, if you're on the sign up for this one, you'll get an email. We'll be doing these once a month. Again, the next one's on really where we are at dental sleep, why we should be involved in it, and how dentists can become involved. And then I think one of the most well-attended ones where Rich and I talk about which devices we use on each patient. And again, if you want to know more about what we do, here's our contact information. And you can type in consult if you just have some challenge you have that you think maybe I just need to talk to somebody on the phone. We have a whole team of dental sleep medicine experts. That's what they do. If you ever get into Bradenton, Jagdeep, come visit us. It's just we have a room full of people that they come to work every day to help dentists do dental sleep. That's their job. It's kind of fun to think that's. I mean, yes, we have software, yes, we have other things, but really their job is to help you implement. And if you want to learn more about what we do, just type consult, and we'll be happy to talk to you about that. So, Rich, you said you looked at this. Do we have other questions, or go ahead?
I want to say thanks, Jagdeep, again, and, go out on a limb here and invite you for a follow-up at some point in the future.
Right.
I know that Guy and I will start using this platform. I have built my practice on physician referrals the last 20 years, so I don't have quite the same need that I think a general dentist would. But I'm happy to start advertising for snoring and sleepy and tired patients, because now I have an avenue to actually do something with them, whereas before I didn't really have that. So I'm excited about this for a couple of different reasons. And I think, Guy, it'd be a good idea at some point, because we can actually show how this is working, in our practices.
Yeah.
Because dentists want to, they never want to, most of them don't want to be the first guy to do this, and it doesn't sound like it costs very much money. You've lowered those barriers. I think kudos to you guys for developing a very sound, team of people that you've laid down the foundation, and you're following all the guidelines and everything. So I think I already have a very high comfort level, and I think if we can get that and show it to other dentists, it'll do nothing but go up.
Yeah, I guess I should mention some exciting news on our part, and then I have one more question that came through. Is that we're forming a partnership with virtuously, and the fact that you can order home sleep tests through our DS3 platform, that the results are coming back in to our platform. And for those of you who understand DS3 and are already members, that's an option now for you. If you don't understand what that means, it just makes the process easier. I mean, what we do every day when we're trying to help dentists is how can we take these 3 steps and make them 2? Or how can we make them, instead of 1.5 feet, let's make them a foot. Let's just shorten the steps, make it easier. And that's why I've really enjoyed this, Jagdeep, that this has been, we have the same goal. We get up each day with how do we get more patients treated, and how do we help these dentists who are new to this just take out the scariness of it and make it as simple as possible. And this fits in with us perfectly. Are you going to be at the Hinman? Someone typed in Georgia. Will you all be at that meeting, or do you know? At the Hinman meeting. It's a dental meeting, a Hinman meeting. It's a.
Yeah, I don't think we're scheduled for that, but.
That question just came in. We will not personally be there. It's a big dental meeting, so it may not be on your radar as much because it's a more general dental meeting, not dental sleep. But I think this has been exciting. If anybody has questions, do you have a contact information? We put in Kyle's. Is that good? Or do we need yours?
If you want to sign up for our telemedicine platform, you can email, obviously Kyle is fine, or we have Leslie Schroeder, and you can share that email with them too.
Okay. If you need trouble getting in touch with Jagdeep and his services and the via web or Virtuox, if for any reason you didn't get the memos in our answer box, just contact us on the email here, info@dentalsleepsolutions.com, and we will put you in touch with the appropriate people, because I tell you, I think this is something that is really going to make our jobs easier, because our job is to help dentists do this in their practices, and we're real excited to get a lot of dentists starting to utilize this service and making it easier for them to get their patients tested. So this has been great. We will have you back. I agree, Rich. So thank you.
Absolutely. Thank you.
Awesome. Thank you very much, guys.
Yep. All right. I'm
Bye-bye.
going to sign off. Everybody will get your CE. Thanks for hanging out. Most everybody stayed on. So thanks for spending the evening with us, everyone. And we'll see you then next month. Take care.
Thank you.
I know.
Email it to us. How do we sign up for this?